I'm Janice Yates, HR Advisor at HEC. Today we're going to talk about Hawaii's Prepaid Healthcare Act, which requires employers with one or more employees to offer medical benefits to eligible employees. The Prepaid Healthcare Act covers nearly all employers but doesn't apply to government employers or employees working under collective bargaining agreement. The law is different from the Affordable Care Act, which covers large employers with 50 or more full-time employees or full-time equivalent employees. Under the Prepaid Healthcare Act, an employee becomes eligible after having worked 20 or more hours per week for 4 consecutive weeks. Once the employee has met this eligibility requirement, the company must enroll the person in a medical plan at the earliest time, which is usually the first of the following month. What happens if your employee tells you he or she doesn't need medical coverage? If the employee is covered under another medical plan, such as through a spouse or second employer, and that plan meets the law's requirements, the employee must complete the health insurance waiver form called the HC5. Employers must retain the completed HC5 for 2 years. Employers do not need to submit the completed forms to the Department of Labor and Industrial Relations unless the DLIR requests the information. The waiver is good for 1 year, and a new waiver must be completed each December if the employee continues to waive coverage. Keep in mind that the company cannot coerce an employee into waiving medical coverage. What happens if an eligible new hire doesn't waive coverage or return the enrollment form to sign up for medical coverage? Can the company go ahead and enroll that employee? Yes, the company is obligated to provide coverage to all eligible employees unless the employee waives coverage. The company can enroll the employee in the lowest cost plan and deduct the employee's share of the premiums from his or her paycheck without the employee's written authorization. How much can the company charge an employee for medical coverage? Under Hawaii law, the company must pay at least 1/2 of the premium and cannot charge the employee more than 1.5% of his or her monthly wages. Does the company have to pay a portion of the premium for an employee's dependents? The answer depends on whether the company offers an A plan, which provides benefits equal to the benefits provided in the plans which have the largest number of subscribers in Hawaii, or a B plan, which provides a lower coverage of benefits. If the company offers the A plan, the company can require the employee to pay the full cost of dependent coverage. However, if the company offers the B plan, the company must contribute at least half of the cost of the coverage of dependents. Many people in Hawaii work at multiple jobs and may be eligible for health insurance from more than one company. If you have an employee who is eligible for health insurance from another employer, you should verify with the employee which employer is the principal versus the secondary employer. The status is important because a secondary employer doesn't need to pay health care coverage. The principal employer is the employer who pays the employee the most wages. If you are the secondary employer, you should have the employee sign the HC5 form to indicate the secondary employer status. What happens when an employee is unable to work due to an illness or hospitalization? Under the Prepaid Healthcare Act, the company is required to continue to cover the employee for the month that the disability began and for up to 3 months thereafter, even if the employee is terminated after the disability began, or for the period for which the employer continues to pay the employee regular wages, whichever is longer. Hawaii law requires both employer and the employee to continue to pay their respective share of the premiums. Employers who are also covered under the Affordable Care Act should analyze their continued coverage obligations under that federal law. Although that topic is beyond the scope of today's video, HEC members are welcome to call us to discuss ACA issues to ensure proper understanding of both federal and state laws. Thank you for tuning in.